Ranking Member Schmick to move your Amendment 198.
Thank you, Mr. Chair. I move Amendment Blake 198.
It's been moved and seconded that Amendment 198 be adopted. Remarks, Ranking Member Schmick.
Well, thank you, Mr. Chair. This amendment adds men or boys representation onto the committee. My other amendment also did that, but I failed to mention that. So this amendment just adds that classification to the committee. Urge its adoption. Thank you.
Thank you. And I am respectfully asking for a no on this amendment. One of the reasons is that the rest of the entities represented on this council come from government agencies, government councils, state-run councils. This particular amendment would allow someone without a state connection into the position. There is a bipartisan bill out there right now that will create a commission on men and boys. I think when that council does become active, or if it ever does become active, and I hope it does, that would be an appropriate time to add a member to the committee representing the needs of young men and boys. And the other thing, too, that I will say is we absolutely need to address health disparities that young men and boys and men are suffering from. There is data, and it is true that men are disproportionately more likely to be incarcerated, disparately more likely to become addicted, disparately more likely to commit suicide. These are true issues that need to be addressed. Men are suffering, and their loved ones are suffering because of their suffering. It absolutely needs to be addressed, but at this time, with this amendment, I'm asking for a no because I think there's a better path. Thank you. So we'll move on to, we'll move on to adoption of the amendment. Those in favor of the amendment signify by saying aye.
Aye.
Those opposed say no.
No.
The amendment is not adopted.